Welcome to our deep dive today. We're going to be tackling something pretty complex. It's the opioid epidemic. And, you sent over a ton of research excerpts and infographics and even a recommended reading list. So you're clearly really wanting to get a handle on this. So our mission for today, I guess, is to kind of figure out where this crisis came from and like what its impact has been and like what are some potential ways forward.
Yeah, it's a big one. I mean, one of the things that strikes me is how intertwined it is with like healthcare, economics, even law enforcement, like to really get a grasp on where we are now. I think understanding how this crisis evolved is crucial.
Right. Okay, well, I'm just going to throw out a number that really stood out to me. 4. As in, like, approximately 4 people die every single day in Canada from opioid poisoning.
Wow.
Yeah, and it's kind of a stark reminder, I think, of how urgent this is, especially, because it's not like this is happening somewhere far away. This is happening right here.
Yeah, no, absolutely. I mean, Canada and the USA are actually 2 of the hardest hit countries globally. Yeah. And within Canada, it's British Columbia, Alberta, and Ontario that are feeling the most impact. And it's not just geography either. I mean, if you look at the demographics, it's men between the ages of 30 and 39 who are most affected.
That's a really specific age range.
It is.
Wow. It really puts a face to it when you think about it that way. And then there's fentanyl. I mean, it seems like fentanyl is such a huge part of this whole story. Like, I saw one report that said 81%, so like 8 out of every 10 opioid toxicity deaths in Canada involved fentanyl. And that was just in the first 3 months of 2021.
Yeah, fentanyl has really changed the landscape of this whole thing. I think to understand how we got here, it's actually really helpful to visualize the epidemic in 3 distinct waves. It's like one of the infographics you shared, actually, it breaks it down that way.
Right, yeah. That one that had with the waves.
Oh, exactly.
Okay, so wave 1, that was from 1999 to 2010. That was like the era of prescription opioids, right? And this is where it gets kind of crazy to me because it's not just individuals seeking out drugs. It's like the medical system itself was kind of creating a public health crisis through overprescribing of painkillers.
Absolutely. And a lot of people don't realize how much pharmaceutical companies played a role in that. Like, remember OxyContin? That was introduced back in 1996 by Purdue Pharma.
Right.
And they had this whole aggressive marketing campaign that actually downplayed the risks of opioids. They were pushing this whole narrative that these drugs were non-addictive, which is crazy.
No way.
I mean, that misinformation aimed at both doctors and patients, well, you can imagine, it fueled this massive surge in prescriptions, and then, of course, inevitably, addiction rates skyrocketed.
It's like just a classic example of corporate greed just having these ripple effects that continue to this day.
Yeah.
Okay, so then we move into wave 2. That's 2010 to 2013, and that's when heroin enters the picture.
Exactly. And with so many people already addicted to prescription painkillers, pills started to become scarce and expensive on the black market. Heroin was just cheaper and easier to get.
Right, so basic supply and demand.
Exactly.
Okay, so we've gone from overprescription to people seeking out cheaper alternatives, and that takes us to wave 3. So this started around 2013 and going to the present day, and that's where fentanyl takes center stage.
And this wasn't just random. This was actually a pretty calculated move. Drug cartels saw a shift in the market and an opportunity for profit. And fentanyl is just much cheaper and easier to produce than heroin, which makes it perfect for mass distribution. The problem is it's also far more potent and unpredictable. And so that's led to a really sharp increase in overdose deaths. And what's even scarier is that because it's so potent, even a really small shipment of fentanyl can generate massive profits for cartels, which makes it really hard for law enforcement to even try and disrupt the supply chain.
It's like we've gone from a public health crisis to a situation where the drug itself is now incredibly dangerous and difficult to control.
It's like a runaway train almost.
Yeah, I think that's a really powerful way to put it. And it really underscores the urgency of all of this. I mean, we can't forget that behind these trends, there are real people whose lives are actually at stake.
That's true. And it's so important that people can recognize an opioid overdose if they see it happening. One of the infographics that you sent, it actually does a fantastic job of listing the signs and symptoms.
Yeah.
It's kind of like knowing how to use a fire extinguisher. Like, hopefully you never need to use it, but in an emergency, it could literally save someone's life.
Absolutely. One of the first things to look for is their breathing. Is it very slow? Is it irregular? Has it stopped altogether?
Okay.
Also look for things like bluish fingernails or lips, a limp body, or if they're making deep snoring or gurgling sounds. And if they're unresponsive, like they're not answering when you talk to them or shake them, or if they have what are called pinpoint pupils, those tiny pupils, those are all really serious warning signs.
Okay, so if you see any of those signs, what should you do? The very first thing you should do is call 911.
Right.
Immediately. And if you're trained to administer naloxone and you have it available, that's also known as Narcan, administer it right away. And while you're waiting for help to arrive, try to monitor their breathing and keep them awake if you can.
And so even if you give someone Narcan, you can't just assume everything is okay.
It's actually shorter acting than most opioids, so you might need to give them another dose once it wears off if they still have opioids in their system.
Oh, wow.
So, yeah, you really have to stay with them until help arrives. But I think just knowing these signs and knowing how to respond can literally make all the difference. But beyond the immediacy of like an overdose, I think it's really important to understand some of the key terms and the different treatment approaches for opioid addiction.
Right. And one of the infographics that you sent actually defined some of those key terms, like toxic drug supply, pill mill, doctor shopping, medication-assisted treatment, or MAT, and opioid use disorder. Like, these are all phrases we hear, but it's good to have a clear definition, I think.
Yeah, for sure. I think understanding these terms allows individuals and communities to have more like informed conversations and productive conversations about this crisis.
Right, moving away from fear and misinformation.
Exactly.
Yeah. Okay, so let's talk about treatment approaches. One of the sources you sent highlighted like two main categories: pharmacological treatment, which is often using opioid agonist therapy or OAT, and then what they called recovery and treatment approaches.
Right.
So can you just break that down a little?
Yeah, so with OAT, medications like methadone or Suboxone are prescribed to help manage withdrawal symptoms and to reduce cravings and the risk of overdose.
So it's kind of like providing a safer alternative to help wean the brain off opioids, right?
Yeah, that's a good way to think about it. But opioid addiction is really difficult to overcome. And I think it's important to remember that a purely pharmacological approach isn't always enough.
Right. So that's where the recovery and treatment approaches come in, like therapy and counseling.
Exactly. A combined approach is generally the most successful. Medication-assisted treatment plus psychotherapy can address not only that physical dependency, but also those underlying psychological and social factors that contribute to addiction.
Right. So it's about treating the whole person,
right,
not just the symptoms.
Exactly.
Okay. Well, let's dive a little deeper into methadone and Suboxone then.
Okay.
Because those are the two that you mentioned, and they're both used for OAT, but they're different in a lot of ways.
They are. So methadone, that's a long-acting synthetic opioid, so it's designed to replace shorter-acting opioids like heroin or fentanyl.
Right. And I remember reading that it typically lasts for about 24 hours, which helps to reduce cravings and those really tough withdrawal symptoms. But I also read that it's mainly distributed in liquid form.
Yeah.
Which can be a barrier for some people. And I think there's a higher risk of overdose with methadone compared to Suboxone.
You're right, there is.
Okay, so then Suboxone. What's interesting about Suboxone is that it has two active ingredients, right?
Right.
Buprenorphine and naloxone.
That's right. And it's available as a film or a pill, so it's a little bit easier to access. And it's also longer acting, so it provides relief for 24 to 36 hours.
Oh, wow. Okay.
And that naloxone component is really important. It actually blocks the effects of other opioids, so it makes Suboxone a lot safer in terms of overdose risk.
Oh, I see. That makes sense.
Yeah, and it's actually been available in Canada since 2007.
Okay. So we have these two medications that are playing like a really crucial role in managing opioid addiction. But let's go back to naloxone or Narcan, because we mentioned it earlier. And it seems like it's getting a lot of attention lately as a really vital tool in actually fighting overdose deaths.
Yeah, it's an incredible medication. It actually has no pain relief or psychoactive properties, so it's not something that people use recreationally. It's really designed to reverse that opioid-induced respiratory depression, which is the leading cause of death in overdoses.
And it works quickly, right?
Yeah, incredibly quickly. It actually starts working within like 30 seconds of administration, so it can literally bring somebody back from the brink of death.
Yeah.
But as we mentioned earlier, it is shorter acting than most opioids, so you might need to administer another dose if the person still has opioids in their system.
Oh, right, right. And I guess it's important to remember, too, that it only works if there are opioids present.
That's right.
It's not like a general antidote for everything.
Yeah, exactly.
But it is, really valuable for first responders, but also for everyday people who might find someone overdosing.
Absolutely. I think having naloxone readily available and knowing how to use it, it can be the difference between life and death.
This has been incredibly informative, but it feels like we're just scratching the surface of this incredibly complex issue. What really strikes me is how interconnected this crisis is with these broader social and economic factors.
Yeah, absolutely. I mean, the opioid epidemic doesn't exist in a vacuum. It's really closely linked to things like poverty, homelessness, mental health, and even past trauma. A
Hmm.
lot of people who are struggling with opioid addiction are also dealing with this like really complex web of other challenges.
Yeah, and one of the research papers you provided, it actually talked about adverse childhood experiences, or ACEs,
Yeah.
and it was suggesting that experiencing trauma or adversity in childhood, it really increases a person's risk of developing substance use disorders later in life.
Yeah, there's a really strong link there. ACEs can have a big impact on brain development and emotional regulation, which can make people more susceptible to addiction. And I think it really underscores the fact that to address this crisis, we need to look beyond just the drugs themselves. We need to look at those underlying social determinants of health that make people vulnerable to addiction in the first place.
Yeah. It sounds like a systemic issue that needs a systemic response, right?
It really does.
Addressing things like access to affordable housing and mental health services and stable employment, like these are all key to supporting people in recovery, but also preventing future cases of addiction.
You're absolutely right. Those are all essential components of a truly comprehensive strategy.
So we've talked about how complex this crisis is, but let's kind of zoom in on the specific challenges of treating opioid addiction. One of the sources that you sent mentioned that it's one of the most challenging addictions to overcome. Why is that?
Well, opioids, they have a really powerful effect on the brain. They actually hijack the brain's reward system and create this incredibly powerful drive to keep using them, despite any negative consequences. And then you add on top of that the fact that the withdrawal symptoms are notoriously awful.
Right.
So quitting cold turkey is just incredibly difficult for most people.
Yeah. I can only imagine. I remember reading about the physical symptoms. I mean, the nausea, the vomiting, muscle aches, insomnia, like even severe anxiety. It just sounds so difficult to go through.
It really is. And then there's also that psychological aspect, too, because opioid addiction often happens along with other mental health conditions like depression and anxiety, which makes things even more complicated.
So it's like a multifaceted challenge that needs a multifaceted approach. We talked about medication-assisted treatment, or MIST. But what are some of the other therapies or support systems that are out there for people who are, battling opioid addiction?
Well, luckily there are a lot of different options. Cognitive behavioral therapy, or CBT, is one that's really commonly used. And that helps individuals to identify and change negative thought patterns and behaviors that contribute to their addiction. And then there's also motivational interviewing, which is an interesting technique. And it helps people to explore their own mixed feelings about change and then build their own internal motivation for recovery.
So it's about helping them to come to their own reasons for wanting to change.
Exactly, yeah. It's very empowering. And then, of course, there are support groups like Narcotics Anonymous,
Right.
and those provide a really great sense of community and shared experience for people in recovery. It's a safe space to connect with other people who really get it. They've been there, they understand the challenges, they can offer support, and they can learn from each other.
Yeah, finding strength in those shared experiences is so powerful.
It is.
It's encouraging that there are resources out there for people. And, your resource list included some local Ottawa clinics that offer various treatment and support services. So it's great to see that communities are really stepping up to address this.
It is, and I think it's important to emphasize that recovery is possible. I mean, there are so many people who have overcome opioid addiction and are living really fulfilling and healthy lives.
Right.
And I think sharing those stories of hope is really important because it can provide, kind of a light at the end of the tunnel for people who are still struggling.
Yeah, that's a message we need to hear more often, for sure. But let's shift gears for a minute and talk about a different aspect of addressing this crisis, and that's the concept of harm reduction.
Okay.
So harm reduction is a public health approach that aims to reduce those negative consequences associated with drug use. But I think what's unique about it is that it doesn't necessarily require abstinence as the primary goal.
Right. So it's about meeting people where they are and acknowledging that, abstinence might not be realistic or even an immediate goal for everyone.
Yeah.
And it recognizes that people use drugs for all sorts of different reasons. And so it really focuses on providing practical strategies to minimize the harms that are associated with that use.
Okay, so can you give some examples of harm reduction strategies?
Yeah. So One of the most, I think, widely known is needle exchange programs.
Right.
And those provide sterile needles to people who inject drugs. And that really helps to reduce the spread of infectious diseases like HIV and hepatitis C.
Right.
And then there are supervised consumption sites. They're also sometimes called safe injection sites.
Right.
And those provide a safe and clean space for people to use drugs, but it's under the supervision of medical professionals.
Oh, I see.
So that if an overdose happens, they can intervene immediately.
Right, right. I mean, I know these harm reduction strategies can be controversial, but it sounds like they're really about saving lives at the end of the day.
Yeah, I mean, the data is pretty clear that harm reduction strategies are really effective in reducing overdoses and the spread of infectious diseases and other harms that come with drug use. I think it's just a really pragmatic and compassionate approach that really prioritizes public health and people's well-being.
So it's not about condoning drug use. It's about acknowledging the reality of it and then taking steps to minimize the potential consequences.
Exactly. It's really about shifting the focus from punishment to public health and treating addiction as a health issue, not a moral failing.
Right. It's about fostering empathy and understanding rather than judgment and stigma.
Absolutely.
Yeah. This conversation about harm reduction has been really eye-opening, I think. It really highlights how important it is to approach this entire crisis with nuance and compassion.
Yeah, I agree. The opioid epidemic is complex. There are no easy answers.
Right.
But it's an issue that needs our attention, it needs our understanding, and it needs our action.
Yeah, I think that's a really important point. And we're going to explore some of those potential solutions and avenues for action in the next part of our deep dive. But for now, we're going to take a quick break.
So, before the break, we were really diving into the stark reality of this crisis, the evolution of the drug supply, and some of those different treatment approaches that are being used to address opioid addiction.
Yeah, it's heavy stuff. But I think it's so important to understand the broader context. Like one of the things that really struck me going through all this material is just how interconnected this crisis is with so many other social and economic issues.
Yeah, you're absolutely right. It doesn't exist in isolation, It's really deeply connected to things like poverty and homelessness and lack of access to mental health care. And as we talked about earlier, the impact of trauma, especially in childhood, can significantly increase the risk of developing substance use disorders later in life.
Right, right. That makes me think about that resource that you shared about adverse childhood experiences, or ACEs, I think they were called.
Yeah.
It's just a powerful reminder that addressing this crisis, it really requires like a much broader lens than just focusing on the drugs themselves.
For sure. Things like experiences of abuse, neglect, or even witnessing violence in childhood, those can have a real lasting impact on brain development and a person's ability to regulate their emotions.
Right.
And, that can make them more vulnerable to addiction and other mental health challenges.
Right, right. It really highlights the need to address those underlying, social determinants of health that contribute to addiction in the first place.
Absolutely.
Like ensuring access to affordable housing, mental health services, stable employment. These are all crucial for supporting individuals in recovery and also just preventing future cases of addiction.
100%. It's a systemic problem that requires a systemic response, Investing in those areas isn't just about social justice. It's a crucial public health strategy.
Yeah, totally. So we've talked about the complexities of this crisis. Can we zoom in a little on some of the specific challenges related to treating opioid addiction? Because one of the sources you sent mentioned that it's one of the most challenging addictions to overcome. Why is that?
Well, I think one of the reasons is that opioids have a really particular effect on the brain. They kind of hijack the brain's reward system, and it creates this incredibly powerful drive to continue using them despite negative consequences. And then, of course, there's the fact that the withdrawal symptoms they're awful. So quitting cold turkey is just incredibly difficult for most people.
I can only imagine. I remember reading about the physical symptoms like nausea, vomiting, muscle aches, insomnia, even severe anxiety. It sounds so difficult to endure.
It really is. And then you add on top of that the psychological component, because opioid addiction often goes hand in hand with other mental health conditions like, depression, anxiety, which complicates the recovery journey even further.
So it's like a multifaceted challenge that really needs a multifaceted approach. We talked about medication-assisted treatment, or MATI. But what are some of the other therapies or support systems that are available to people who are battling opioid addiction?
Well, thankfully, there's a wide range. So cognitive behavioral therapy, or CBT, is really commonly used, and it helps individuals identify and change those negative thought patterns and behaviors that contribute to their addiction. And then there's motivational interviewing, which is a really interesting technique that helps people explore their ambivalence about change and build their own internal motivation to recover.
So it's more about helping them to kind of come to their own reasons for wanting to change.
Exactly. It's very empowering. And then, of course, there's support groups like Narcotics Anonymous.
Right.
And those can be really powerful in providing a sense of community and shared experience for people who are in recovery. It's a safe space to connect with others who really understand, they've been there, they know the challenges, and they can offer support and learn from each other.
Yeah. Just finding strength in those shared experiences. So powerful.
Absolutely.
It's really encouraging to see that there are resources available. And, your resource list included some local Ottawa clinics that offer different treatment and support services. So it's just great to see that communities are stepping up to address this.
It is. It is. And I think it's really important to emphasize, that recovery is possible. I mean, there are so many people who have overcome opioid addiction and are living really healthy and fulfilling lives.
That's good to hear.
And I think sharing those stories of hope is so important because it can be, kind of a light at the end of the tunnel for people who are still struggling.
Absolutely, yeah. That's a message we need to hear more often. But let's shift gears for a minute and talk about a different aspect of addressing the opioid crisis, and that's the concept of harm reduction. Harm reduction is a public health approach that aims to reduce the negative consequences associated with drug use. But what makes it kind of unique, I think, is that it doesn't necessarily require abstinence as the primary goal.
Right. It's about meeting people where they're at and acknowledging that, for some people, abstinence might not be a realistic or even an immediate goal.
Yeah.
And it recognizes that people use drugs for all sorts of reasons. And so it really focuses on practical strategies to minimize the harms associated with that use.
Okay. Can you give some examples of harm reduction strategies?
Yeah. So one of the most, I think, widely known are needle exchange programs.
Right.
And those provide sterile needles to people who inject drugs, which really helps reduce the spread of infectious diseases, things like HIV and hepatitis C.
Right.
And then there are supervised consumption sites. Those are also sometimes called safe injection sites. And they provide a safe, hygienic environment for people to use drugs, but it's under the supervision of medical professionals so that if an overdose does occur, they can intervene immediately.
Right. I mean, I know these harm reduction strategies, they can be kind of controversial, but it sounds like at the end of the day, they're really about saving lives.
Yeah, they are. And the data is really clear on that. Harm reduction strategies are incredibly effective in reducing overdoses, the spread of infectious disease, and other harms associated with drug use. It's a really pragmatic and compassionate approach that prioritizes public health and people's well-being.
Yeah, it's not about condoning drug use. It's about acknowledging the reality of it and taking those steps to minimize the potential consequences.
Exactly. It's about really shifting that focus away from punishment and towards public health, treating addiction like the health issue that it is and not a moral failing.
Right. It's about fostering empathy and understanding rather than judgment and stigma.
Exactly. And I think that's a really powerful shift in perspective.
Yeah, for sure. This conversation about harm reduction has been really eye-opening. It underscores the importance of approaching this whole crisis with nuance and compassion.
I agree. The opioid epidemic is a complex issue. There are no easy answers.
Right.
But it is an issue that demands our attention, it demands our understanding, and it demands our action.
Yeah, that's a really important point. And we're going to explore some of those potential solutions and avenues for action in the final part of our deep dive. Well, we've covered so much in our deep dive into the opioid epidemic, from like the historical roots of it to how complex treatment is and, those harm reduction strategies that we were talking about.
Yeah, it's been pretty comprehensive. I commend you for really wanting to dive into this. It's a multifaceted issue.
Right. I definitely feel like I understand this a lot more deeply now.
Yeah.
But it also, kind of leaves me with this question of like, where do we go from here? What are some of those potential solutions or pathways forward in addressing this epidemic?
Well, that's the million-dollar question, isn't it? I don't think there's any single solution, but I do think there are a number of really promising approaches being explored and implemented. And, prevention really stands out as a key area of focus.
Right, that makes sense.
Yeah.
I mean, if you can prevent people from becoming addicted in the first place, you're going to significantly reduce the impact of this whole crisis. So what does prevention look like in this context?
Well, I think education is a huge part of it,
Well,
both for healthcare providers and the general public.
Right.
We need to make sure that doctors are really well informed about the risks of opioids and, responsible prescribing practices are crucial. And then educating the public about the potential dangers of these drugs and promoting alternative pain management strategies. That's also really important.
Right. That makes me think about our conversation about, the role of overprescribing painkillers in fueling that initial wave of this whole epidemic.
Okay.
It seems like, changing prescribing practices is a huge step in the right direction.
It is. It is. And, it's not just about limiting prescriptions. I think it's also about exploring and promoting, a wider range of pain management options that don't rely solely on opioids.
Okay.
Things like physical therapy or mindfulness techniques or even acupuncture. But remember, as we were talking about earlier, the opioid epidemic is so deeply connected to those social and economic factors that we were discussing.
Like the issues of poverty and homelessness and lack of access to mental health care and the impact of trauma, especially during childhood.
Exactly. And so addressing those root causes it's fundamental to any effective prevention strategy. We need to create a more equitable and supportive society. We need access to affordable housing, quality mental health services, job training programs. All of these things can help reduce a person's vulnerability to addiction.
So prevention is really about addressing both the supply side, like with responsible prescribing, but also the demand side by tackling those social determinants of health that make people more susceptible to addiction in the first place. But what about people who are already struggling with opioid addiction? I mean, it seems like expanding access to treatment is a huge part of this too, right?
Oh, absolutely. But the reality is that there are barriers to accessing treatment. I mean, for a lot of people, the cost is just prohibitive. So we really need to be advocating for policies that ensure that treatment is affordable and accessible for everyone who needs it. And then there's also the issue of stigma, the shame and the fear that often prevent people from seeking help in the first place.
Yeah, stigma is so powerful. It can make people feel so isolated and afraid to reach out for support. So, I mean, what can we do to break down that stigma?
Well, I think it starts with fostering empathy and understanding. It's about shifting the narrative away from blaming individuals and really seeing addiction as a complex health issue.
Right.
I think having these open and honest conversations about addiction and sharing stories of recovery and challenging misconceptions, all of that can help to create a more supportive and compassionate environment.
Yeah, it's about moving away from judgment and shame towards, understanding and support. What about advancements in treatment approaches? Are there any new or innovative treatments kind of on the horizon?
Yeah, there's actually a lot of really exciting research happening right now. Scientists are exploring longer-acting medications for opioid addiction, which could really help with, cravings and withdrawal symptoms. And there's a growing interest in non-pharmacological approaches like, mindfulness-based therapies or even things like transcranial magnetic stimulation.
Wow. It's encouraging to hear that there are so many people working towards these more effective treatment options. It gives me hope that we can, make some real progress in helping people who are struggling with this.
Yeah, I think hope is really important. And, it's not just about these medical interventions. It's also about creating a really strong network of support for people who are in recovery. So things like peer support groups, sober living environments, job training programs, these can all really help to provide a sense of community and accountability and purpose, which are, really vital to long-term recovery. And of course, we can't forget about the role of families and loved ones.
Yeah, it's true. I mean, addiction impacts not just the individual, but has these ripple effects on their entire, network of relationships.
Exactly.
So, I mean, supporting families, providing them with resources and education, that's a huge part of this as well.
It really is. I think, addressing the opioid epidemic, it really requires this multifaceted approach, this tapestry woven from prevention and treatment and harm reduction and just unwavering community support. It's a big challenge, but it's one that we can overcome, especially if we have that collective commitment to action and that shift towards compassion and understanding.
Well, this deep dive has been incredibly informative. I feel like it's just the beginning of my own journey. and understanding this issue.
Yeah.
I'm going to be looking into those resources you shared, those podcasts and books and websites. I want to learn more. And I, encourage everyone listening to do the same.
Absolutely. I think knowledge is really empowering. The more we all learn about the opioid epidemic, the better equipped we are to really advocate for change and support those who are struggling.
Well, before we wrap up, I just want to thank you so much for sharing your expertise and insights with us today. This has been a really, really eye-opening conversation.
It's been my pleasure. And remember, I think this is a conversation that needs to continue. Let's keep talking, let's keep learning, and let's keep working towards a future that's free from the devastating grip of the opioid epidemic.
Yeah, that's a great point. To our listeners, thank you for joining us on this deep dive. We hope that this episode has given you a deeper understanding of the opioid crisis and inspired you to be a part of the solution. Share what you've learned, reach out to those in your community who might be struggling, and, advocate for meaningful change. Together, we can make a difference.